Okay, so personal statement for medical residency in the US. So first of all, we would go what is a personal statement. Okay, so what is a personal statement? Honestly, this question is very subjective. For example, if you know 50 persons and they are in the field of medicine, matched in the US residency program, they are going to tell you their different perspectives, and all of them are correct. They are right in their own way because there is no true answer and there is no right and wrong idea to write a personal statement. Every other person will give you his own opinion or understanding about what a personal statement is. You know what is right or wrong, you are going to decide for yourself. Because it's your personal statement and you are going to decide what do you want to include or what do you want to exclude, except that there are few exceptions. So a personal statement is a narrative in which you share your motivations, experiences, skills, and goals. Essentially, it it's your chance to present yourself as a unique and authentic candidate. But my definition is it's a set of your experiences, both clinical and personal, those which are unique to you and shaped you as a person and as a doctor. And those attributes make you well fit for the residency program. So, in my definition, you see a couple of perspectives. First is experiences. Like, we all experience different things. We are built different. We are born different. We have different kind of experiences, both personal and clinical. So we have to navigate through those experiences and see how those experiences have impacted us, because every experience that happens in our life creates an impression on our personality and on our thought that we later express in our life. So you have to think and navigate and write that experience that holds that importance in your life. Are you getting my point? I hope so, because that experience will have
Yes.
an effect on your personality and then obviously on your profession. For example, you are seeing a patient who suffered from acute promyelocytic leukemia, and you dealt with that patient. You showed empathy. You empowered your communication skills, empathy skills while talking to that patient. So that patient is actually the hallmark that you can use for your personal statement because it has shaped you as a person and as a doctor. So the first thing is experience, and the second thing, that experience actually has an impact on you that has shaped you. And last thing, last but not the least, and the most important one, you have to see from the eyes of program directors of residency program. What do they want? What do they expect from you? For example, the residency programs expect you to be a good teamwork and leadership skills, to show empathy, to have good communication skills, work ethics, and then navigate your personal statement according to that. We will come towards this point later on. But first point is, have an experience that has shaped you as a person and as a doctor. I have emphasized this thing again. Think like you are a program director and see from his eyes, because like think you are a program director and you are taking interview of hundreds of candidates, and each candidate has a different personal statement. So for most of the candidates, we copy each other's personal statement, we copy each other's ideas, but they get to know very easily. Because, for example, if a person has written a personal statement about his grandmother died from myocardial infarction, and then another person has written the same kind of personal statement, it gives them a hook that they are copying each other. So I would advise to write your own personal statement, not copy each other's ideas. Okay, so types of personal statement. And to be very honest, each of these are my perceptions, the definition, types, and like everything. I believe there are many kinds of personal statement, but what we go through in our what we see mostly is one is hooked personal statement and the other is structured personal statement. Hooked personal statement means like you are hooked towards one idea, one single theme, and then narrate your personal statement according to that hook statement. For example, Imran is interested in basketball, and he says that because he is so much interested in basketball, he wants to narrate his whole personal statement based on this love for basketball. And then he is going to draw parallels between basketball and the field of medicine. He's going to navigate that how this sport or activity has helped him to be a better person or a better doctor. Like he can talk about his teamwork skills, leadership skills, how to handle situations in pressure, like working in ICU. And honestly, these type of personal statement also work because some of my friends match writing these kind of personal statement, so it works. But the essence is it should be your true passion. For example, he should be really interested in basketball. Only then he can draw parallels, and only then he can talk about these parallels in interviews. And the drawback of this kind of personal statement is sometimes you are more hooked towards basketball rather than the medicine. So you have to play the game equally, like giving medicine equal importance and narrate how this particular activity has helped you to be a better doctor. The easiest one and the safe to go are structured personal statement. In this personal statement, you are going to write your personal statement in paragraphs, and each paragraph has a different story, has a different perspective, and has a different theme. The first paragraph, I wrote my personal statement for the structured one because I couldn't find any hook in my life, or those hooks were not good enough to narrate in personal statement. So the structured one, the first paragraph is about your personal background, your personal journey. Can be about your siblings, can be about your parents, can be about yourself. And just a minute. Okay. So we were talking about structured personal statement, and I talked about different paragraphs. The first paragraph was about your personal background and your personal journey. It can include your personal inspirations. For example, you are inspired by your parents, you are inspired by your siblings, you are inspired by a particular personality, and then narrate the whole just a little bit, like 5 lines about your personal background. But to be very honest, this part is very important because you are giving them a start. And for each story, for every book, every story, the starting lines and the starting paragraphs are the points when you are going to decide either you are going to read that story or that book or not. And the same goes for personal statement as well. Like if I read the first line of personal statement and it catches my attraction and attention, then I'm going to read the whole one. That's why your first paragraph should be very much attractive, I guess, clear and concise. The easiest way to make it catchy is to add a quotation or something uh, more poetic, because it's human nature that poetry attracts us, something poetic, something nature wise attracts us. So that's the idea, to make it more attractive. The second paragraph can be about your personal medical journey. Your why did you become a doctor, and why you are interested in internal medicine. Like Imran said, he's interested in internal medicine because it gives him an opportunity to solve a puzzle. Like he finds it interesting to navigate through all the differential diagnosis by seeing the patient signs and symptoms. So he can write this statement. And for these kind of statements, don't just narrate it, exemplify it. For example, then he's going to give an example. Every time I see a patient of diabetes or hypertension, I find the clues very interesting. And then really love to navigate through those clues. And if you are going to give an example of a rare disease, maybe you can give an example of multiple myeloma, and you give once a patient came with these signs and symptoms, I navigated through those and made my differential. The topmost was multiple myeloma, which was then confirmed by the further testing. So you have to also narrate examples from your clinical experiences, but be very careful. Those examples should be based on facts and reality, because they are definitely going to ask you in the interviews. And if they're based on reality, then only then you can do it well and narrate it well. Okay, the third paragraph should be about your US clinical experience. You can write about why you are interested in US healthcare system. You can also give an example while your observerships or electives, you saw this particular patient case that really intrigued you or made you feel interested in that field. The fourth paragraph, I wrote it about the program. For example, if I'm applying in Charleston Area Medical Center, I'm going to write that I have done a rotation at CMC. I am very much impressed by the collegiality, and it feels like a home, like a family to me. That's why I'm very much interested in this particular program. And the last paragraph, it should be just 2 lines why you are a good fit for their program. So for this, you have to navigate the program goals and your goals that should be well aligned. For example, you can say that I see that your program goals and my personal goals make a perfect alignment with each other. That's why I consider myself a best fit for your program. But obviously, you have to explain a little bit. Okay, so I know it's a lot, but we are going to discuss it again. Okay, some common ideas that I personally don't like, but you can use. For example, I have read so many personal statements stating that growing up in a small village and having faced financial difficulties, death of a closed one, disease of a closed one. I don't like these ideas, to be very honest, because the first concept, growing up in a small village, literally 80% of the people are going to use. Not 80, like still 50 or 60% people will use this concept. So it becomes very boring and repetitive. Death of a closed one. This is such a sensitive topic. My very good senior wrote her personal statement based on death of her mother. And each time in an interview, they ask her how was that experience, and she started shaking and trembling, and you know, it created an emotional toll and impact on her, and she couldn't even speak about it. So I don't advise it. Just keep it very natural, easygoing. The same goes for disease of a closed one. For example, if I'm going to describe the bipolar disorder of my brother, then obviously I will be emotional discussing. So keep your emotions aside, because you are not going to speak well. It impacts your functionality. What are common mistakes that we do writing a personal statement? We follow each other blindly, as I said. We use each other's ideas. As I said, every person is different, born different, built different, face different, and it is unlikely that we'll have the same experiences. We all have different kind of experiences. PDs reading the same personal statement get bored, as I said. Tips: find your strengths, find your qualities that fit the program's goal. For example, teamwork, leadership, empathy, kindness, ethics, professionalism. Can be medical knowledge. For internal medicine people, yes, let's be very clear. So for different specialties, they have different kind of mindset. For example, pediatric people are really, they like empathy, they like communication skills, they like that the person should be very friendly, and they judge you by these kind of things. For psychiatry people, they also judge you by empathy and by your communication skills, but communication skills take more importance in psychiatry than in pediatrics. For internal medicine, they are very analytical. They judge you based on your professionalism, research, publication. They judge you based on your teamwork and leadership skills. So you have to be mindful that what skills you are going to write for your specialty. And I guess it's obvious. For example, a peds guy should be empathetic, should be compassionate because he has to deal with the kids. A psychiatry guy has to be kind enough, or he has to be a good listener because he's going to listen to his patients. Just a second. Okay, the other thing that I said, make it a bit poetic. For example, starting with a quotation or something poetic because it catches readers' attention. Uh, Tips for you, it should be maximum 1 page. You can divide it into paragraphs, and each paragraph should have 5 to 7 lines. Do not make paragraphs lengthy. You can use ChatGPT or other AI sources to refine it, but first you have to write the personal statement in your own simple words and simple language. And while writing that, do not worry about the mistakes, grammatical errors, or punctuation mistakes, because you are just going to write a draft and your own rough ideas. If you don't find any hook, go with the structured one. Give example of patient experiences. But those examples should be based on reality. 80% of the chances that you will be asked about those experiences. Write different and personalized personal statement for programs, at least for your top choices. I tried writing for 50 programs, but like you can write, for example, if you're going to apply for residency in all New York programs, you can write a personal statement for stating that you have a family in New York if you really have a family, or or like if you have done rotations in a particular program, like let's say University of Oklahoma, you can say that I have done a rotation at University of Oklahoma, and that makes me interested in your program. Okay, this is very important. This is very interesting thing for you. You know, the relationship of personal statement with the interview. If you follow the structured pattern of the personal statement, you are going to see that all the questions they are going to ask are covered in your personal statement actually. For example, the first paragraph, the personal background, tell me about yourself. The second paragraph, why you are interested in that particular field, tells them why IM, why peds, why neuro. This second question. The third paragraph, that why you are interested in US healthcare system, is the answer the question why USA. Another question, why our program is covered by the fourth paragraph. And secondly, they ask you about patient experiences during interviews. And you can also cover these things in your personal statement. Last paragraph, how you are a best fit for us. So all of these interview questions are basically covered in your personal statement as well if you are going to follow the structured one. Even if you follow the hooked one, because you are going to draw parallels, still you can include these things. We had a message. Okay, now I am going to share some two examples of personal statement. One is the hooked one, and the other one is just a generic one, structured one. So this is about the hooked one. The person has written personal statement related to the football. You can see from the roar of the crowd under the stadium lights to the precise timing of a perfect pass, the football has been a central part of my life. So I really like the first sentence because it catches readers' attention. It is more of poetic rather than narrating a game. So whenever there's something poetic, it catches your attention. So try to be poetic or start with a quotation, easy thing. You can find quotations from the chat GPT regarding your interest. Then the person has written, I can, it taught me the success is built on the foundation of teamwork, quick decision making, and the ability to thrive under pressure. Very good, because he has written what he has learned from this particular game, that he is interested in teamwork, good, decision making, good, and ability to thrive under pressure, good. Every play, every strategy, and every decision had the power to change the outcome. This early passion for the football had stayed with me throughout my life and ultimately shaped my approach to medicine. It's fine, but I guess just narrating it with sentences does not make much impact. But since it's the first paragraph, so I think it's fine. Next, I guess he has given examples. On the field, I learned what that while talent is important, the real key to success is how well you work within a team, communicating clearly, anticipating your team's needs, and making split second divisions decisions in high pressure situations. In medicine, the same qualities are critical. During my 6 months as a medical officer in the ICU at Mayo Hospital, I found myself in the situations where a patient's life depended on rapid, accurate actions, just like in football game where the final. Okay, so what's the mistake in this thing? He has given a very generic example. Um, it's not believable for me until he explained what disease the patient was going through, what was the situation, what he did, how it impacted, and how it helped him in the better patient care. So whenever you are going to give a patient example, give it based on reality, not just narrative. Just like in the football game where the final minutes can determine the outcome, I relied my ability to stay calm under pressure, assess the situation, and coordinate with my team to deliver the best possible care. Next, he has described about leadership. Football also has taught me resilience and adaptability. That's good. Then he has given an ICU example. Each patient presented unique challenges. No 2 days were alike. When a patient was with acute respiratory failure, needed intubation, I acted swiftly, remembering that, like in football, preparation and quick thinking make a difference in critical moments. Again, I want to make examples a bit more realistic, but it's fine too. It's better than the previous one actually because at least it has the diagnosis. These parallels between football and medicine have shaped me. Doctor, good thing. Okay, I am drawing to your residency program because I know you will allow me to build based on these skills. Okay, the ending is good. I like this personal statement actually, and I'm going to rate it Alex 7 out of 10. Okay, this is personal statement. All of us know Edmund Hillary, who this is actually the structured one, not the hooked one. All of us know Edmund Hillary, who famously conquered Mount Everest, but most of us don't know about Reinhold Messner, who climbed Mount Everest without oxygen support. I am like Messner in my journey because I have faced challenges head on throughout my life. Emerging from a lower middle class background with 7 siblings and a single source of income, we faced challenging time. Money was scarce, and there were nights when we had to sleep without food. But my mother's struggle and guidance propelled us through those difficulties. We, the first generation to graduate from the college in our family, achieved significant milestones, with 5 of my siblings earning scholarship to attend medical school. What are goods and bads in this personal statement? I really like the first initiate sentences because these are something that catches someone's attention. I don't like this little bit mercy seeking behavior because money was scarce and nights when they had to sleep without food, it makes them vulnerable and mercy seeking. I mean, he may have faced it, but it does not look good. The last sentence is also fine, but it describes about his family and not about him. Maybe he can write a sentence that how these experiences have shaped him as a person and as a doctor, then it becomes more convincing for me. Okay, so next he has written about his mother. My mother taught me invaluable lessons in kindness, empathy, and love, shaping me into the compassionate person I am today. If that person is applying in pediatrics, then it is good because he is writing the kind of things that pediatrics people are looking for: kindness, empathy, and compassion. I have always found solace and joy in the company of children. That's why he's applying in pediatrics, feeling deeply at ease when talking to them and sharing moments with together. Playing a role in the care of my niece was a profound experience. That's good. He has given an example that shows his bond with the pediatrics. During my medical school year, I was involved in an organization. That's good. He has given an example again. Completing my clinical externship in the USA was a highlight of my medical energy as I witnessed a remarkable blend of technology, teamwork, and compassionate patient care and evidence based medicine. From pediatric care at MSK New York to child psychiatry at University of Oklahoma Charleston Area Medical Center, I gained diverse experience that shaped my perspective within the field. I don't recommend writing the names of the hospital because it may give an impact you are just interested in those particular hospital. But anyways, you can just write the name of states maybe. Then he has given an example of a 6-month-old patient suffering from having a cord blood transplant at anemia and pig disease at MSK to start successfully. Just days passed at the rotations and showcasing the efficient and compassionate care I aspire to bring. I really want that he must have highlighted it more or elaborated it more because it could really serve as a hook point to his bond with the pediatric care. I'm highly interested in pursuing a pediatric residency at CMC. Completing a clinical observership with Dr. Sophia, Dr. Rahil, and Dr. Badawi was an extraordinary experience. I observed good. He has done a rotation there, so that makes sense. Ultimately, my personal and professional experience make me a good fit for your program. Given the opportunity, I aim to work diligently and have a positive impact on your life. So that person is actually me. I can see, I can actually analyze myself. Okay, so now I want you to give me what did you understand? Yes, Imran.
So, yeah, you want me to summarize what you said?
I want you, but actually it's a task for you later on, maybe like to find,
Yeah.
tell me how you are going to write your perception, the hooked one or the structured one.
I personally don't like the hooked one either. I'm going to give a structured, maybe I'll add the theme of basketball in it somewhere.
Yeah,
But yeah, I think the hooked one kind of gives an impression that you're too much obsessed with the thing.
yeah.
So it can work for you or it cannot work for you. So I don't think I'm going to go with the hooked one, but I'm going to definitely mention this because I am really passionate about it, but it's not the main central thing in my life.
And one
Um,
thing also, they ask you in interviews that why didn't you
yes,
pursue basketball professionally? And you have to answer that. You can say that I tried, I went to national level, but obviously some people have who have really an interest in that particular thing.
yeah, actually, I think the answer for me is pretty simple. I'm not that tall.
Okay, then I guess go with the structured one and add a little bit
Yeah,
about your interest with the basketball.
yes,
Okay, maybe your first paragraph can be about basketball, and then you can narrate all the hook one in just one paragraph, I guess. But
hmm,
start it like with good sentences.
yes,
Okay, now tell me, you have an answer about why you are interested in internal medicine, but elaborate it with examples. I'm sure you must have some examples. You just have to go through your mind, go through your
yes,
past, and see what examples you can bring on plate.
yes,
And if you haven't done any US clinical rotation, you can just talk about that. Like you don't really need to mention doing my clinical rotations. You can just say, I'm interested in applying residency in the US because of these particular things. You know,
right,
you can just say that. And if you don't have any US clinical rotation, I guess that's fine. And for the fourth paragraph, um, for that particular program you are applying and you don't know what kind of program is that, go through that website and see what
yes, yeah,
particular things they are trying to highlight, you know. And
right,
there are 100% of chances that you are going to find something. For example, during my some of my interviews, there was a program who had a special psychology integration with the pediatrics. So this was the hallmark of their program. Like psychologists were working in close relation with the pediatrics, and I included it.
oh, okay,
Yeah, you can find things in the website. Okay, thank you so much, Imran. Now,
yes, yeah, thank you so much.
Dr. Thorani will tell us what kind of personal statement she's going to write.
Dr. Khan, I don't think so. I have any hook in my life, so definitely I will go for a structured one.
Yes, that's safe to go.
Yeah.
Okay, and how did you find these personal statement, the both of these?
They were fine, but not so much any interesting. They were fine.
Yeah.
Like football, like the first one that was football, I don't like much. Like it was not so much like suspicious. Like I have to read a lot. I have to read a lot. So I
Yeah.
don't like them much.
Hmm. Yeah. Wait a minute. I guess I missed something important. Um, I will tell you now that there were some more slides. Okay, one more important thing. It is not a matchmaker or breaker thing. For example, you cannot say that because of personal statement, I got matched. Because obviously it's a blend of everything. So it's not a matchmaker thing. But yet it is powerful enough to increase your chances of match. The most important thing I would like to mention is not to include any controversial thing, any controversial topic. For example, mentioning chronic mental illness in your family, like bipolar disorder or schizophrenia or depression, or even depression. You don't have to talk about the sensitive topics. And mental illness, unfortunately, are still sensitive topic to